As a beginner, just remember three simple situations. Situation number one, surface antigen is positive and anti-HBC is also positive, which means the patient is infected and patient is exposed to the virus. In that case, just look at the anti-HBC fraction, whether it's IgM or IgG. If IgM is positive, it indicates a recent exposure, which means it must be an active acute hepatitis B virus infection. If the anti-HBC fraction is IgG, then it must be a remote exposure, so I can make a diagnosis of chronic HBV infection. Situation number two, surface antigen is negative and anti-HBC is also negative, which means the patient is not exposed to the virus and likely the patient is not infected as well. In that case, look at anti-HBS. If anti-HBS alone is positive, then it must be because of the vaccinated status. And here is the final and a tricky situation where surface antigen is negative but anti-HBC alone will be positive, which means we have a definite evidence of exposure to the virus, but we cannot rule out active infection also just because surface antigen is negative. So in that case also, just look at the anti-HBC fraction. If IgM anti-HBC is positive and if the surface antigen is negative, it indicates the patient is recovering from a recent exposure, which means it's nothing but a window period. If the IgG fraction of anti-HBC is positive, then it indicates either the patient is recovering from a chronic infection or it might be a recovered remote exposure to the infection as well. And to truly differentiate from whether the patient is recovering from a chronic infection or already recovered from a remote infection, we need to look out for other parameters like HBV DNA and anti-HBS.
Thank you so much, sir. No one has simplified hepatitis B serology under a minute.
And let me ask you a simple question. Our patient is having surface antigen positivity and anti-HBC IgG positivity. So what's your inference? Mention your answers in the comments below.